Module H, endocrine system. Our endocrine system is a system of glands that secrete chemicals directly into our bloodstream and regulate all of our body functions. As you can see in this image, there are many different glands throughout the body, and they're pictured in this slide. So glands are located throughout the body, and like we said, they secrete chemicals called hormones that regulate our bodily functions. They maintain homeostasis or balance in our body. They influence growth and development. These chemicals or hormones regulate sugar in the blood and calcium in the bones. They regulate our reproduction, and they regulate how fast cells burn food. When our endocrine system is functioning properly and normally, our skin is warm and dry, our weight doesn't fluctuate a lot, we have normal appetite, we're awake, alert, and oriented. When we age, a normal change of aging is to have decreased levels of those hormones and chemicals, including decreases in insulin production, and our body becomes less capable to deal with stress because of these changes in these chemicals and hormones. Variations from the normal that you want to report right away: headache, blurred vision, dizziness, weakness or hunger, irritability, sweating, dry skin, confusion, significant weight gain or loss, changes in appetite, tiredness, increased thirst, and increased urination. And that kind of leads us right into our first disease of the endocrine system, one that you probably are all familiar with, diabetes or diabetes mellitus. This is the most common disorder of the endocrine system. It occurs when the pancreas produces too little insulin or does not know how to use insulin properly. Insulin is needed for glucose to move from blood into cells so that it can be used for energy. So if insulin is not, there's too little of it, or if it's not being used properly, that glucose isn't being moved from the blood into the cells to be used for energy as it should. So it's building up in the blood, which causes the increased blood sugar levels. So there are 3 types of diabetes, one you might not have thought of. There is type 1. The onset of type 1 is typically during childhood or early adulthood. This is when the pancreas does not produce insulin. Therefore, it's a lifelong condition, and it's managed by taking daily doses of insulin, being on a special diet, and regular blood glucose testing. Type 2 diabetes typically develops after the age of 35. This is when our pancreas, it secretes insulin, but it doesn't know how to use it well. Type 2 diabetes develops slowly, and it's usually controlled by diet and oral medicine, but some people will need to go on insulin as well. The third type of diabetes is gestational diabetes. This is unique to pregnancy. So gestational diabetes occurs during pregnancy, and once pregnancy is over, the diabetes can resolve, but sometimes it can also develop into type 2 diabetes. So our role, we want to ensure that we're following care plans, ensure that meals are served and the resident eats their diet. We have to report, especially talking about diabetes, we have to let the nurse know if the resident has refused a meal or if they have a big decrease or increase in intake, because the nurse is going to base insulin on a blood sugar reading that was taken before the meal was eaten. So if they don't eat, this is going to affect the amount of insulin or possibly medication that we want to give. We want to encourage residents to follow an exercise program that assists with circulation. Observe for signs of low and high blood sugar. So this is going to be hypo and hyperglycemia. And we're going to review over some of those signs and symptoms of both of those, as they're both really important. So signs of low blood sugar, which is also called hypoglycemia. Hypoglycemia, your resident may be hungry, they may be nauseous and vomiting, feel weak and very shaky, they may be sweating or diaphoretic, headache, dizziness, their pulse may increase, their blood pressure may drop, their respirations may increase, they may actually become confused, Their skin may appear cool and clammy, and when it gets severe, it can lead to convulsions and unconsciousness. Signs of hyperglycemia. So this is when blood sugar is too high. And some of these signs are similar or the same to hypoglycemia, but there are some differences. So that's why you want to review these. So hyperglycemia, weakness, drowsiness, thirst, dry mouth, feeling hungry and having to urinate frequently. A lot of times you'll see a flushed color of the face. This is when they may have a sweet breath odor. Respirations are going to be rapid and deep. Blood pressure will be lower. Skin will be dry. Headaches and blurred vision are common. And as they get further along, again, convulsions and even coma can occur. So all very important signs and symptoms to be aware of, to know to look for. We've mentioned in previous lecture how important foot care is for the diabetic patient, because diabetics tend to heal poorly because of their increased sugar levels, and because they tend to have neuropathy and decreased sensation in the lower extremities. That's why it's really important to follow the foot care as directed by the care plan and encourage good foot care. And that concludes the endocrine system.